And yes, we are live on WFM 91 Fantastic 7, Nigeria's first and only radio station for women and their families. 4 minutes gone past the 10 o'clock hour. And this is a beautiful, beautiful day to be alive and be hopeful. Yes, the program is Radio Doctor for benefit of those who are just joining in. This is WFM, Women Radio. And the program is Radio Doctor brought your way Monday through Friday, 10 to 11 a.m. So Radio Doctor is, simply put, is our own way of showing you how much we love you, how much you mean to us, and to ease the pressure on your pocket. Yes. So it's a program packaged, put together to bring professionals your way, doctors your way, to consult for free. And we also have a window where you can physically see the doctor to, further x-ray your health issues. Yes, that's what the program is about. It's basically a free health consultation program on radio. The only free health consultation program on radio is brought to you by Radio Doctor. It's Radio Doctor brought to you by WFM 917. So I'm very passionate about the program Radio Doctor. As a matter of fact, it happens to be the best content for me here because I'm very particular about the health of people, about your health, because I am of the opinion that you need to be healthy to want to do everything else. So every other thing is hinged on your health, right? So your health is including your mental health, not just your, when we say health now, you have to include mental health because that's also very chief. Yeah, so the program Radio Doctor is your free health consultation program where doctors consult for free on radio. Now, for those who would naturally tell me, Chinyere, listen, I've been following the program Radio Doctor for a minute. I know all of the doctors and all of the topics we've treated on radio. Now, your type I defined this morning. Would love to hear from you how the program has impacted you purposefully and positively so. So would love to hear from you. Send us an SMS or WhatsApp message capturing how you have benefited from the program Radio Doctor. I will be reeling out that number in a heartbeat. And also, if you know what ways we can serve you better with the program Radio Doctor, also send an SMS or WhatsApp message to that number. Yes, you can definitely be a part of the program Radio Doctor. I'll be reeling out the numbers in a bit. But as I'd always say, charge your phones, get your earpiece. For some phones that would need earpiece to access the radio, get your earpiece, get pen, paper, because it's always very instructive on the program Radio Doctor. Yes, once again, 6 minutes gone past the 10 o'clock hour, and I am thanking you so much for holding your horses on WFM 917, and I'm welcoming you officially to the program Radio Doctor. My name is Chinyere Timothy Crown, and welcome to the program Radio Doctor. Remember, Women's Health on Radio Doctor is supported by ACT Foundation. Women's Health on Radio Doctor is supported by ACT Foundation. Today on the program, I have Dr. Ede Edekpolo Osazwa. He's a consultant obstetrician and gynecologist at St. Ives Family Hospital, and he will be consulting and advising on the importance of regular pap smear. He'll be consulting and advising on the importance of regular pap smear. We'd love to hear from you. Call us on 07000 917 917 07000 917 917. Now, the number for SMS and WhatsApp message, do well to indicate your name and where you're listening to us live from to 0703 175 6537 0703 175 6537. You can also join the discussion by sending in your contributions to our social media platforms, Facebook, Instagram, Twitter, and YouTube at WFM 917. Or you could log onto our website at www.wfm917.com to listen live from any part of the world. Thank you so much once again for staying tuned to WFM 91 Fantastic 7. The program is Radio Doctor. My name is Chinyere Timothy Crown. 8 minutes gone past the hour of 10 a.m. and we're getting right into the program. I'm now being joined by my Dr. Osazwa, who will be consulting for free on today's edition of the program Radio Doctor. Good morning, Dr. Osazwa. All right. So while we are still, trying to establish our doctor here, do well to call us on 07000 917 917 07000 917 917 to be a part of the conversation. So yesterday on the program, this is just me putting this out there real quick. For those who missed the edition of Radio Doctor yesterday, we looked at how to manage sickle cell anemia in children, how to manage sickle cell anemia in children. And I love that the doctor, touched extensively on what sickle cell is, as against some beliefs, that it could be spiritual, it could have some undertone of spirituality or maybe witchcraft. So the doctor established that sickle cell is genetically inherited from parents who have sickle cell traits. So a parent who is AS, married another person who is AS, they'll, give birth to sickle cell children. And then she went further to tell us how we can manage sickle cell children or sickle cell, patients. She went from routine drugs to avoiding mosquitoes, always sleep in the net, avoid rain, avoid extreme sports as much as possible. And then she talked about, how important it is to eat clean. Your diet has to be clean. So lots of veggies in there, fruits, to help our warriors to stay healthy. It was quite an instructive session with Dr. Fumila yesterday on the program. So this is just a recap for those who missed out on the program Radio Doctor yesterday. Yes, so that's what we looked at yesterday. Today we're looking at the importance of pap smear. But as I'd always say on the program, if your health concern does not, is not related to the topic we're treating, still feel free. Don't tell me, Chinyere, my belly they pay me. It's not pap smear we're talking about. Feel free to also call and tell us what it is. Tell the doctor what it is you are going through with your health. I'm sure the doctor would have some solutions for you. Numbers to call to be a part of the program: 07000 917 917 07000 917 917. Send us an SMS or WhatsApp message to 0703 175 6537 0703 175 6537 are the numbers to send in your SMS or WhatsApp message to. 11 minutes gone past the 10 o'clock hour here on WFM 91 Fantastic 7, Nigeria's first and only radio station for women and their families. Yes, the program is Radio Doctor. I love to call it your one-stop shop for everything your health. Yes, it is possible to bring doctors. Chinyere, is it even possible to bring doctors to radio? Yes, it's very possible. The brand has been doing that as a way to show you how much we care and love you. So we bring doctors here to consult for free and, educate you on the importance of prioritizing your health. That's what the program Radio Doctor, is basically about. So if you've been following the program and you've benefited one way or the other, we'd love to hear from you. Send us an SMS or WhatsApp message to 0703 175 6537 0703 175 6537. Send us an SMS or WhatsApp message to 0703 175 6537 0703 175 6537. So last week on the show, I had this very lovely caller who called in to say, listen, Chinyere, it's not as if I don't want to go to the hospital to, for checkup. We looked at the importance of regular medical checks. As some illnesses have been said to, would have been managed better if it's detected early enough, right? So he said, it's not as if I don't want to go to the hospital, but I don't have the means. Do I understand? I totally understand. I mean, looking at what the reality of the cost of living is in Nigeria, my brother, hey, my dear brother, I understand. So, and that's why the program has been packaged for you. So we're cutting out the point from the home to the hospital. The money you could spend for transport, we don't remove that one. The money you could pay for card, we don't remove that one. Consultation, I'm not saying you shouldn't go to the hospital. No, you should definitely see a doctor. But in the event that you're not well off, you're not able to afford a doctor, listen to WFM 917 Monday through Friday, 10 to 11 a.m. You would definitely get a doctor all you need to do is just to call in to say, oh, doctor, my chest they pay me, or my hand can't they pay me, my back can't they pay me. So he will want to ask you a few questions to establish, say, age, your BMI, and all of that. So your responsibility is to ensure that you just buy 100 naira credit and call the doctor here on the program Radio Doctor. I know that some of my friends will be saying, Chiri is just preaching this morning. No, it's fine. I'm just prepping you. Sometimes people would say, this is the first time I'm hearing of the program Radio Doctor, but so I'm just prepping you as to what the program is basically about. Yes, so I'm now being joined by my guest, Dr. Osazua, and he will be walking us through what pap smear is about. If you're hearing the subject pap smear for the first time, that's one of the reasons why you should even stay tuned. I mean, pap is not akamu, it's not pap. Yeah, all right. So good morning, Dr. Osazua. How are you doing?
Good morning.
Great to have you.
Thank you for having me once again.
So, are you still in the spirit of independence, or you're out of it already?
No, independence. We work all through yesterday.
Oh, I see.
Working all through.
So, no time to rest, no time to cut cake. Oh.
No time to cut cake. We have to be focused this time around.
That cake will go cut them because I'm hungry, no vest.
I'm patient leader, so you bring my own cake for me. The one that you cut yesterday.
Me, I be patient. I need you to every hour. All right, 15 minutes gone past the 10 o'clock hour, and this is Radio Doctor right here from WFM 91 Fantastic 7. Yes, so Dr. Osazua is already here, and we're getting right into the program. Call us on 07000 917 917, 07000 917 917. All right, so Dr. Osazua, what exactly is pap smear, and how does it work to detect cervical cancer?
Thank you very much for having me once again. Happy Independence, Nigeria. Happy Independence, Lagos. Can you hear me clearly?
Go ahead, we can hear you.
Clearly? Okay,
yes,
good.
Yes.
Okay, good. So, the topic today being pap smear is something that we need to know. It's very important, especially with the rising increase of cervical cancer in this part of the world, and the newer cases that we are now seeing in cervical cancer. So it's now very important that we must know about pap smear and must counsel women about pap smear. Simply put, that pap smear is a way of screening for cervical cancer that involves the use of a special instrument, not a special instrument, using the cyto brush or using the IU spatula to take a smear from the cervix and send for histology. And this is a modality for screening for cervical cancer. Now, why do we need to screen for cervical cancer, as I said? The incidence of cervical cancer has risen, and cervical cancer being a disease that can easily be prevented, so we need to screen. And secondly, cervical cancer, before it becomes cervical cancer, there is usually some stages it pass through, which we call the pre-malignant lesions. Then if you can treat the pre-malignant lesion, automatically cervical cancer is prevented. And the only way to detect cervical cancer, one of the ways of detecting cervical cancer, is to do what we call pap smear for them. A little anatomy of the female genital tract: you have the vagina, you have the cervix, and you have the womb on top, which is the uterus. Now, the cervix is where we normally take our smear from, and we take it at the what we call the squamosal junction. That is the distance between the cervix as well as the vagina. They will not take it for cytology, where they will not tell them whether the pap smear is normal or abnormal. Let me rest so that you can ask other questions.
All right. So I was trying to grasp all of the clinical terminologies you were using there
Yes.
God help me. Yes, 18 minutes gone past the 8 o'clock, the 10 o'clock hour, and this is the VFM 917, Nigeria's only radio station for women and their family. Yes, the program is Radio Doctor, my favorite program, where we bring doctors your way to consult for free. Call us on 07000 917 917 07000 917 917. Send us an SMS or WhatsApp message to 0703 175 6537. Remember to indicate your name and where you are listening to us live from. I have Dr. Osazua right here with me, and we're looking at what pap smear is generally. Dr. Osazua, I need you to help me put this in very simple terms. I mean, layman, extremely pedestrian terms. What is pap smear?
Okay. Pap smear is a way, is a method for checking for cancer of the cervix. It's a pap smear is a way for checking for cancer of the cervix.
Okay.
That's a simple one.
All right. Thank you so much for putting that in very, plain Jane terms for me. All right. So the next question would be, some people who are listening to, this conversation for the first time, even though I have heard of pap smear before, but I never get the time or the money. I don't know if it's expensive, but somewhere in my brain, I feel it's expensive. But when I hear pap smear, it blessing our big thing, right? So people who are listening are wondering, is this affordable? Is this pocket friendly? Can I just go to any clinic around me to get pap smear done? Do they have like a special center where we can have pap smear? Please, I'd love you to speak to that.
Okay, pap smear is not expensive. Okay, I don't know how much it costs anyway, but I think it's not very expensive. It's something that's readily affordable, and you can do it anywhere. You can do it in the hospital. You can do it in the hospital. You can do it in the health centers. You can do it anywhere. The major reason is to teach the people how to carry out pap smear, and thereafter you perform a pap smear for them. So what you normally do when you talk about pap smear is that there's what we call an instrument which is called speculum. To open the cervix, we pass the cyto brush or something that we used to take and rub it on the cervix and put it on a slide. Then we send for test. When we send for test, the result comes out. They will now interpret whether it's normal or abnormal. So pap smear can be done. It can even be done in an office. Because I have once done a pap smear for people, for some banks. I don't want to mention them.
Okay.
They called me. I just got what I needed. I took all the smell. I got my alcohol, 95% alcohol. I got my slide. I got my ice spatula, the speculum, disposable speculum, and I went to a bank and I did for them. So you can do it anywhere. You can do it for your people in women radio. You can do it in the public. You can do it for civil servants. You just have a closed room where you can take your spell. Okay. I know that is done by the cytology.
All right. Thank you so much for clearing that. We sincerely appreciate Dr. Osazua for you providing that information and light to attend to that particular concern, if pap smear is affordable or not. All right, 22 minutes gone past the 10 o'clock hour, and this is WFM 91 Fantastic 7. The program is Radio Doctor. Yes, there's a doctor here live for you. Call us on 07000 917 917, 07000 917 917. Send us an SMS or WhatsApp message indicating your name and where you are listening to us live from to 0703 175 6537, 0703 175 6537. We are looking at pap smear. So it's a way to check, or a process or a procedure with which doctors check for cancer of the cervix. And then we've also established that it's pocket friendly. It's not something that will cost you so much, so it's something you should begin to think of if you haven't done it before. But this brings me to the next question. So one time I had a pain in my breast and I wasn't sure what it was, but I was just afraid. So I went to the laboratory to ask to do, is it mammogram now, to be sure if it's not something to be worried about. And then the man said, how old are you? At the time, maybe I was 29. So he said, so that particular test that I wanted to do, has like a purview or a range where you can actually have that test done. It can't be done when you're younger than, the specified age. So it brings me again to the next question. For pap smear, How often should women go for pap smear? And is there like an age range, where women can have that?
Okay, so I'm trying to do that. Cancer of the cervix is caused by human papillomavirus. Now, if you say cancer is caused by human papillomavirus, and the human papillomavirus is sexually transmitted. Okay, sexually transmitted. So that, but there are other cofactors that will make the woman have, what is it called, cancer of the cervix. So other factors include cigarette smoking, use of oral contraceptive, repeated number of pregnancy, repeated childbirth, mortality. But the obviously that causes cancer of the cervix is human papillomavirus. So what we do is that for anybody that is at risk of having human papillomavirus, okay, or will be exposed to human papillomavirus before, irrespective of the age, should do pap smear. Should do pap smear. So that's to say that sexually active women, whether they have child before or they are not, should go for pap smear.
Okay. All right. Thank you so much, Doctor.
Irrespective of the age, yes.
Okay. 25 minutes gone past the 10 o'clock hour, and this is Radio Doctor. Remember, Women's Health on Radio Doctor is supported by ACT Foundation. Join the conversation now by following us on all our social media platforms: Facebook, Instagram, Twitter, and YouTube at WFM917. You can log on to our website via www.wfm917.com to listen live from any part of the world. Yes, what are we talking about on the program today? Pap smear. This is a very salient conversation. Thank you so much, Osazwa, for coming through with this. So for X-ray, right? We don't hear stories about how constant or regular X-ray can, predispose a patient to maybe cancer because of the light that be waiting the Tokanunu. I just wanted to ask you, for pap smear, does it have a downside? Like if one undergoes pap smear, the process, does it put the woman at risk of having any other illness?
No, that's not true at all.
Okay.
Pap smear is very safe. As I said, it's simple. You can do it in anywhere. You can do it in the office. You can do it anywhere that is there. Even in churches. Now, people are being screened for cervical cancer because of the detrimental effect. Because when they become cervical cancer, there's nothing anybody can do. That's why I encourage everybody to do pap smear. Go ahead and do pap smear. Because now you have to determine the pre-malignant lesion before it becomes cancer. So pap smear will help you to determine whether the person have any lesion that will lead to cancer.
Right.
And the beauty of pap smear is that the service is readily available. If you open the speckle, if you pass the speckle to the vagina, you can really see the service. Even by looking at it, you know that the service that is good or that is not good.
Okay.
So you can easily do it. Okay? And secondly, because if you do a pap smear and it's normal, and you do it again and it's normal, that guarantees you, you're not likely going to have cervical cancer. Then, thirdly, if you do a pap smear for a patient and you mistakenly pick pre-malignant lesion that will progress to be a cancer, it takes time for that pre-malignant lesion to become cancer. It takes time. Because it takes time, that implies that if there is any pre-malignant lesion, you can easily treat it before it becomes cancer that becomes curable. So pap smear is safe. It doesn't cause any form of cancer. You even help the patient more by doing it. Yes.
All right. Thank you so much for putting that out also. 27 minutes gone past the 10 o'clock hour. And you should keep your messages coming in now and your calls. Call us on 07000 917 917, 07000 917 917. Send us an SMS or WhatsApp message to 0703 175 6537, 0703 175 6537. The program is Radio Doctor here from WFM 91 Fantastic 7, and we have Dr. Osazwa. We're looking at pap smear. All right, I'll head straight to our messages this morning before we go on with the rest of the program. This one reads, "Good morning, WFM. My name is Mrs. Unwadiaju. I hope that was well articulated. I'm reaching you from Magboro, Ogun State. Thank you for all your teachings. I listen to every bit of them. God bless you. God bless you too. Please, my question is quite different from the topic of today. I am a Dr. Sazwa, can you hear me?
Very well, very
Great,
well. Yes.
great. So she's saying, I am a first-time mom. I have passed my EDD twice, and I don't have signs of labor yet, but carrying out my daily exercises. The hospital has assured me that I am going to have a normal delivery, but I am worried because I don't want the baby weight to become an issue. The last time that I checked the baby was 3.8 kg already. Please help me to clear my fears. Thank you so much. Thank you so much, Mrs. Onwadiaju, for sending this in. We sincerely appreciate it.
I want to address that.
Yes.
So depending on the protocol, people have different ways of managing postdatism. Okay, for me, someone that I passed, I got it to her date and I passed briefly. If she doesn't enter spontaneous labor on her own, what we normally do, we start the labor for her by what we call induction. Okay, so when we induce, they will progress. Okay, we'll progress and have a spontaneous vaginal delivery. There are two things. When you induce labor, it can either progress and have spontaneous vaginal delivery, or sometimes the induction of labor can fail and the patient will have a cesarean section. But what I can say this woman to do is that, since the date has passed and she has not done spontaneous labor, let him find out from the doctor what the doctor wants to do for her, what's the plan, so that they can plan for it. But because I won't expect any pregnant woman to carry pregnancy beyond 40 weeks and like 7 days, without getting too long, because if baby stays too long in the tummy, there are also some risk factors that will be associated with the baby. So I encourage the woman to have a discussion with his doctor. What is the plan for the doctor for her? So that if the labor did not start in the next 7 days, they should go for induction of what? Labor. Start it. And there are different ways of induction. Okay? And monitor the progress of labor so that she can progress and have a baby.
Right. Thank you so much, Dr. Sazwa. Mrs. Nwadiaju, I am certain you're listening to radio now and you've heard Dr. Sazwa's consultation or comment on your message. If you're clear, do as he has said, but if you're not clear, do well to send us an SMS again or call us on 07000 917 917 07000 917 917. Mrs. Nwadiaju, did you hear the doctor? Are there questions you still love to ask? Send us an SMS or WhatsApp message to 0703 1756537. Thank you so much. 29 minutes now to the hour 11, and this is Radio Doctor here, WFM 91 Fantastic 7. We have Dr. Sazwa live and direct, and he's treating the issue of pap smear, the importance of pap smear, the consequences of not having a pap smear, and possible treatment for cancer of the cervix. All right, Dr. Sazwa, tell us about the potential consequences of not having regular pap smears for cervical health.
Okay, so when we talk about pap smear, let me quickly describe how you offer your husband. For anybody that have had sexual intercourse before, so it's usually advocated that the person should be doing it every year for the first 3 years. Every year for the first 3 years.
That's is it once a year?
Once a year, yes.
Okay.
Once a year, then thereafter I can be doing between every 3 years until she get to 30 years. When she has got to 30 years, if everything is normal, she can be doing it every 5 years until she gets to maybe 70 years. So people will say 80 years. So every year, for the first 3 years, if it's normal, you start doing every 3 years. So if it's normal after that, we'll not start doing every 5 years, after 30 years. Okay. So it's better for you to understand that you must always do pap smear. Now, pap smear basically helps us to pick, as I said, premalignant lesions. Premalignant lesions, that is things that will become cancer that are not cancer yet. Things that will become cancer that are not cancer yet. So if you get these things that are supposed to be cancer that are not cancer, that implies that you can treat it. Okay? If you get them on time before it becomes cancer, that means you can treat. But when it becomes cancer, it becomes difficult to treat. That means the patient may eventually die because they will normally present late because of the complications associated with cancer of the cervix. Okay? So now the premalignant lesions. So when you do a pap smear, you can say that it's normal. If it's normal, you are fine. You go out, next year again, you do. Then it's normal, you don't bother. You do again another year, it's normal, you don't bother. They must start doing every 3 years. 3 years until 3 to 5 years, until you get to 30. But if it's abnormal, okay, if I want to classify abnormal, I'll try to break it down to the best of understanding of everybody. If it's abnormal, so what are the things that you're going to see that is abnormal in it? Now you can have what we call just infections. Okay, so those infections, okay, like bacterial vaginosis, you can give antibiotics for it. Okay. Now, second, you can see what we call pre-malignant lesions. Okay, we call that is things that will become cancer. Okay. Now, when we see things that will become cancer, now there are big name for it: normal intraepithelial lesion, not negative for normal intraepithelial lesion, negative for malignancy. Okay. Now, if you see this that is not normal, that is abnormal. Okay. So, if you see something that is abnormal, so what you now need to do at that level, you want to triage further to go and do what we call colposcopy for the patient. Colposcopy is a special microscope for visualizing the cervix. Okay? Are we following at all?
Yes, we are here. Go ahead, sir.
Okay. So it's without triage to go and do what we call colposcopy. Now, colposcopy will now help us categorize it into 3 categories, what we call the CIN1, CIN2, CIN3. Okay? So now, so if the colposcopy tell you that, what is that? Colposcopy will not help you to take a biopsy from the cervix. Okay? So when you now take a biopsy from, you now send that biopsy for histology. Okay? That histology will not tell you that, it's either what we call cervical intraepithelial neoplasia 1 and 2. So when you now have all these cervical intraepithelial lesions, you now treat them.
Okay.
And there are various ways of treating them. You can either burn it up, or you can freeze it, or you can do what we call cryotherapy. Or you can cut it off, what you call excision of the transformation zone. So these are the basic things that we do if it's abnormal. So when you now do it, after doing this test, if it's abnormal now, so you now begin to, your screening, you are not going to be doing screening every 1 year again. You will not be doing every 6 months. Every 6 months, you have 3 good results. Thereafter, every 1 year, for the next 5 years, then 3 years till somebody dies off.
Okay.
So that's the simple way. So if you do a pap smear exam, it's normal. You do it again, you do it again, you do it again. If it's abnormal, what you now do for this patient is that you now find that kind of abnormality. If it's simple infections, you give antibiotics for it and repeat the pap smear. Okay. If it's showing that it has some degree of pre-malignant lesion, they will write it there, which high-grade lesion cannot be excluded. So the histology will tell you that. So from that level, you can decide to do what we call human papillomavirus screening. Then you now go and do a special microscope, which is called colposcopy, to look at the cervix and take biopsy. So when that one now comes out and they tell you, it's either 1, 2, or 3, then you now treat. And the patient lives a normal life, have a normal sexual intercourse, and carry their pregnancy to term. And get pregnant and carry pregnancy to term, and live a life and enjoy fulfillment. But if you did not pick all these things and the thing now live for pre-malignant lesion to be malignant lesion, that's why the lifestyle survival rate is not like 5 years. The tells you that the patient will eventually die.
All right. Thank you so much.
Is it clear?
Yeah.
I tried to break it down. Is it clear?
It's clear. Very clear.
Okay.
It is. All right, 23 minutes now to the top of the hour, 11 a.m. And the program is Radio Doctor here on WFM 91 Fantastic 7. Do well to call us on 07000 917 917 to be a part of the conversation. Send us an SMS or WhatsApp message to 0703 175 6537 0703 175 6537. Remember to indicate your name and where you're listening to us live from. Remember, when you call, you have a minute to ask your questions, except the doctor wants you to stay online so you can ask and establish some facts about your health. Yes, once again, the program is Radio Doctor. So, Dr. Sazwa, let me put this out there real quick. When a woman wants to go for, or when the person wants to go for a surgery, they always want pass catheter. Imagine just saying a CSO. When they prepare the woman for CS, when they don't shave and everything, they'll come pass catheter. I said that catheter, I don't like them. So I don't know whether they say, please put me to sleep before you pass catheter. Now I'm asking because This pap smear now, you talked about how one brush should be used and all that. Is it painful? Because that could be another reason why sometimes people may shy away from it. People like me. I beg, this in the pain.
Everybody shall know that unfortunately we deal with a very sensitive part of the woman's body. There are two factors. The process is usually painless.
Okay.
Painless. But that depends on one, how the patient cooperates. Some patients are easily agitated too, and they are frightening. And so, are trying to do some manipulation, they start moving, and they become a bit uncomfortable. So it also depends on the technique. You understand? The technique of the doctor too. So doctors are very good. Some of us are also very meticulous. And the way we handle women is also different from what other people. So we are very meticulous and we are very gentle. So the way we also apply ourselves, how meticulous, we lubricate the speculum, we pass slightly through gently, ensure that you are very polite and gentle because we are dealing with the female, the opposite gender. Then you now pass your cycle brush and take your smell and you come out. So it is usually painless. There are a lot of factors that may make the patient uncomfortable. These the patient can become, some patients have very low pain threshold. Some doctors too are not also as meticulous as we are. I'm not trying to blow my trumpet anyway. At the same time, you have to be very meticulous because we are dealing with the opposite sex. Then when you do that, the system is usually painless, and the patient will have a very nice time.
All right.
So you don't need to pass catheter, you don't need to put patient to sleep. No.
Okay. Maybe I'll have to blow your trumpet for you. I mean, Dr. Sazwa is one of the best doctors we have in Nigeria. You should go see.
Yes, so.
Yes, you are. All right, 20 minutes to the top of the hour, 11 a.m. And this is a very instructive show we are having today on the program Radio Doctor. Call us on 07000 917 917 07000 917 917. To join the conversation, you can also follow us on all our social media platforms: Facebook, Instagram, Twitter, and YouTube at WFM 917. Or you could log onto our website on www.wfm917.com to listen live from any part of the world. Yesterday, we're looking at pap smear, the process or procedure to detect the cancer of the cervix, and Dr. Osazwa is doing justice to the topic today. Remember, Women's Health on Radio Doctor is supported by the ACT Foundation. All right, it's now 19 minutes to the top of the hour, 11 a.m. Dr. Osazwa, I'm going to ask you, for women who have, gone through the process of pap smear and, have been detected that there's something there, something not so good, what sort of lifestyle would you advise for them to lead? And in your course of practice, are there other factors? Are there some sort of lifestyle that would that could predispose or precipitate a woman to getting cancer of the cervix or any other form of cancer?
Yes, there are lots of them. The common organisms that cause CS cervix, human papillomavirus. But there are a lot of factors which are called co-factors. One of them, each of them, there are many. Multiple sexual partners. Okay? Multiple sexual partners, okay? If somebody has a partner that is high risk, for instance, he has a male friend that has plenty girlfriend. So those are predisposed to it. Thirdly, food that we eat that doesn't have vegetables. Okay. Thirdly, for people that are also on the big side, obesity, because of the high level of estrogen that the cervix is exposed to. Fourthly, fifthly, for people who started giving birth on time very early, started giving birth, because that time the cervix is not well strong, and they can be exposed to cancer of the cervix. Fourthly, for a patient that has plenty children, multiplicity, more than 4, because of the repeated childbirth, they can be traumatized to the cervix.
Even 4 7 this thing.
Hello?
Dr. Osazwa, 4 7 not too much.
But not, some people are still giving birth to 7, tell them they will not know. So people that give birth to plenty children, so people also started having sex early. They are exposed to having sex early, only around 12 years, 30 years. Okay? Also, this of adults. People who also smoke cigarettes, who smoke. People who also drinks. Okay? People who also take what we call combined oral contraceptive estrogen pills, especially for those that are having for like a period of 6 years.
Okay.
They are prone to having cervical cancer. Then if they now have human papilloma virus, then they now have cervical cancer. So you can see that there are a lot of risk factors. Some of them you can modify, some of them you cannot modify. But when you can modify, you modify. That is why we encourage all women who have had sexual intercourse before at any level, whether by omission or commission, to have a pap smear done.
All right. Thank you so much, Dr. Sazwa. Just in 1 minute, tell us if there's a cure to cancer of the cervix.
Okay, so I'll just digress back again.
Yes.
If you are doing your pap smear, okay, regularly, before you become cancer of the cervix, which cannot be curable, okay, now you have what we call pre-malignant lesions. I will explain this again. Okay, that is things that become before you become cancer. If you are doing your pap smear regularly, you can easily get this pre-malignant lesion and treat it, and the patient is fine forever. But if the thing has progressed from that before cancer, that pre-malignant lesion is called before cancer. Okay, or precancer period. To become cancer cannot be cured. But you can only treat it, but the outcome is almost like 98% death.
All right.
That's why cancer of the cervix is very, very bad. It's very kind because if you do the right thing, you will not have it. But if you do not do the right thing, the die is why the thing will come.
All right.
So it's said by people who shall humble themselves and presume and turn from their wicked. That means if you do the right thing, that's what the Bible telling them in the Bible.
All right.
It says, if my people shall hearken unto my voice and do that which is right in my sight, and give ear unto my commandment, which I commanded you this day, I will take away the disease from you, from the Lord that healed thee. Exodus 16, verse 25.
Very good. Thank you so much, Dr. Sazwa, for today's free consultation and advice on the impact of, the importance of pap smear to a woman's health. Thank you so much, Dr. Ede Edokpolo Sazwa is a consultant obstetrician and gynecologist at St. Ives Family Hospital. He's one of the best doctors in Nigeria. Thank you so much, sir. We sincerely appreciate your life that you bring on the program.
Thank you.
All right, Radio Doctor on Women and Radio WFM 917 is Nigeria's first free consultation program here on WFM. Remember, Women's Health on Radio Doctor is supported by the ACT Foundation. Thank you so much to the producer of the program, Esther Alaribe, and the executive producer, Tom Okewale Shonaya. I'm Chinyere Timothy Crown.
WFM 91.7.